The lab tests that are common that is done with GI problems is a CBC, which is general for anything, urinalysis, serum bilirubin, cholesterol, ammonia is indicative of liver stuff. PT time is also indicative of liver things. Proteins and other enzymes. CEA and AFP. Make sure you know this one. A CEA and an AFP. AFP stands for alpha fetoprotein, and those are cancer markers. They're tumor markers in the blood that will appear in a blood test if there's some sort of cancerous process going on. So a lot of times I've had patients that are there for suspicion of cancer, and they'll run these lab tests for the patient. A gastric analysis is taking a gastric juices and testing the pH. The H-pylori test can be done through blood, mucus, stool, or breath. So make sure you know the different ways to test for H. pylori. H. pylori is a bacterial infection that causes a lot of GI upset. It actually can cause ulcers and can be responsible for some cancers. So it can be tested with blood, mucosa, which would be taking a biopsy during the EGD, or in the stool, or doing the hydrogen breath testing. For stool analysis, when we collect stool samples, they must be fresh and warm, and that's why I have a little sun down here, because we want our stool to be fresh and warm. Okay, fresh and warm. Can't put it in the refrigerator. You have to run it straight to the lab. Collect and run, collect and run. Okay, here we go. Let's see. After a liver biopsy, how many hours should a patient stay in bed? Okay, y'all should know this. Y'all should know this. Okay, the correct answer is C, 8 to 12. Good job. A client has a colonoscopy. While recovering, the nurse assesses the client's abdomen. Which sign indicates a potential complication of the colonoscopy? Okay, colonoscopy complications. What could that be? Let's see, perforation or bleeding. That's pretty much it for mostly. Okay, now let's look at the answer choices. Rebound tenderness, mild cramping, loose stools, or nausea and vomiting. Interesting. Let's see. Let's start at the bottom. Nausea and vomiting. Loose stools. Definitely not a complication. They did drink all that go lightly, so that's normal. Mild cramping. Well, that air in the bowels can be quite uncomfortable, so I would say that's not it. Rebound tenderness. Interesting. Oops. Okay, so the correct answer was rebound tenderness, because that indicates some sort of peritonitis going on. Okay, this is just a little chart I made for lab testing. Gastric fluids, gastric analysis. It's just a little a combined thing of this testing. So I'm going to pull your eyes down to the Hemoccult at the bottom. So the Hemoccult is a stool test. It's a stool smear on a little card, and if blood is present, it's positive, and if there's no blood present in the stool, it's negative. This is something that patients can do yearly. A occult blood stool or Hemoccult blood stool is something you could recommend they do every year. It's great. You know, if you get a clean colonoscopy at age 50, you can do this every year for basically pennies. It won't cost you hardly anything. And then if you happen to get a positive result, then you can go into your provider and have follow-up stuff done. So it's very cheap, effective screening for colon cancer in a yearly way. Colonoscopy is once and then as needed. This one is yearly, okay, annually. So it tests for blood in the GI tract. False positives can be from eating red meat, too much iodine, antiseptics, or a large dose aspirin, NSAIDs, or excessive alcohol. So patients should avoid these things for a week prior to doing the Hemoccult test. A false negative could be patients who take high vitamin C and iron supplements. We don't want to get false negatives. That would be bad. So they also should avoid vitamin C and iron supplements prior to doing the Hemoccult test. The others are lab tests that are related to GI testing. So you will need to know that an AST, an ALT, and an ALP are liver function tests. The amylase and lipase belong to the pancreas. Bilirubin levels, you do need to know that bilirubin should be less than 2. And the albumin is an indicator of nutritional status. So albumin is an indicator of nutritional status. Do know that the levels is 3.5 to 5. The AFP is a liver cancer indicator. The ammonia is a liver disorder indicator, and it is elevated with patients who have severe liver disease. So I have some little questions here. A client is preparing for an EGD. This includes withholding food and fluids for 6 to 12 hours and receiving a sedative before the test. In addition, the nurse will spray the client's throat with an anesthetic, or the client will gargle liquids in it. What precautions does the nurse take before the client goes for the EGD? Okay, so let's see. We're preparing for an EGD. They have withheld their food and fluids. They're going to receive a sedative. Okay, we sprayed their throat. Now what else? Okay, we'll make sure that they understand what's going to happen to them, that we're going to monitor, put them on a monitor and monitor their airway. Let's look at number 2. The client returns from the EGD. What is important for the nurse to assess? As soon as they return from the EGD, I'm going to use my ABCs and I'm going to assess their airway first, their airway and breathing. Listen to their lungs, see how their respiratory effort is, check their oxygen saturation, and then I'm going to check circulation, which is the oxygen saturation. So make sure your ABCs are good. And then I'm going to assess the gag reflex, see if he can have something to drink. So I'll assess if the gag reflex is back or not. Make sure they don't have any pain, and just keep them comfortable, because after that they're ready to go. Make sure they have a driver home, because they can't drive because they've had sedation, so sedation precautions. Number 3, the client has a potential diagnosis of colon cancer. What tests do you anticipate the physician will order for the client? Okay, so let's say they had a positive Hemoccult and they're at the doctor's office and they think that they have colon cancer maybe. So what labs or what tests do you think they might order? Okay, the obvious, colonoscopy. What about a CEA and an AFP? Maybe some tumor markers, right? If he hasn't done a cult, so maybe a Hemoccult if he hasn't done one yet. Maybe a barium enema or a barium swallow. Those can find tumors in the colon. Maybe a CT scan with contrast. So maybe a bowel prep and do a CT scan. If the CT scan shows something, then maybe a colonoscopy. So there's some things that would probably happen with this patient.